So femur above, tibia below. The knee joint is actually a compound joint. Femur above, tibia below, tibiofemoral joint, but it's also a compound joint, meaning two, between the patella and the femur, patellofemoral joint. So, if you find the inferior pole of the patella, right there, which is the superior attachment of the patellar ligament, on either side of the patellar ligament are two dimples. Now, our dimples aren't real big, but they're right there, okay? You stick your fingers into the dimples, that's the joint line. Femur above, tibia below. So, this is the medial condyle of the femur. And if you go all the way up to the top, that bump right there is the adductor tubercle. That bump right there. That's the distal attachment of adductor magnus. But it's also the most proximal attachment of MCL. So, if the injury she selected was a sprain of the MCL, so people, when I say MCL, I assume you know what I'm talking about. So if I ever say something that you aren't sure what I'm talking about, ask me, okay? So, that's the injury. Sprain of the medial collateral ligament. So, I'm going to palpate, you're going to tell me what you're going to palpate, then palpate it. It tells me what you're going to do so I can make sure you do it correctly. It tells the model I've got to say ouch when you touch that spot. So I medial condyle of the femur and I touch it, she says ouch. I have to think what attaches there. Now for this class, it's the proximal attachment of MCL. Now in real life, it's not that simple because it could also be the attachment site of VM and VMO. It's also the attachment site of the medial patellofemoral ligament. So there's more to it than what I'm making it out to be in this class. So for this class, pain at the medial condyle of the femur, that's MCL. Then I'm going to palpate the lateral condyle of the femur. She says, ouch, when I touch that. You have to think what attaches there. LCL, lateral collateral, attaches to the lateral condyle of the femur. Then I'm going to palpate the patella. So I'm going to palpate the anterior surface of the patella. If she says ouch there, then maybe she has a prepatellar bursitis. Bursa, which we'll learn about this later in the semester when we talk about the knee. Bursas are fluid-filled sacs placed in areas of the body where friction develops. Your body has approximately 150 bursa throughout the body. So it could be that. I'm going to palpate the superior border. If she says pain there, that's where the quads come and attach. I'm going to palpate the medial border. She has pain over here. I'm thinking maybe she subluxed her patella laterally, and to prevent the patella from going laterally, the structures that stabilize the patella medially could have been injured. I'm going to palpate the inferior pole of the patella. She has pain there. That could possibly mean she has like a patellar tendonitis. People call that jumper's knee. And then I'm going to palpate the lateral border of the patella. She has pain there. Maybe she subluxed her patella medially, and the structures that hold the patella, support the patella on the lateral side, vastus lateralis and lateral patellofemoral ligament, maybe have been injured. So people on the lab exam, if you just say patella and that's all you do, you're going to get points off. Okay? I want you to palpate anterior surface, superior, medial, inferior, lateral borders of the patella. Then we're going to palpate the medial condyle of the tibia. So again, you find the joint line, medial condyle of the tibia. If she has pain, she says that hurts there, then I'm thinking that's the distal attachment of MCL. Now, for this class, that's what it's going to be. But in real life, it could also be the pes anserine muscle group. So did everybody learn say grace before tea in anatomy class? That saying? Say grace before tea? So what the three muscles, what does say stand for? Longest muscle in your body. Sartorius. Grace. Say grace. Gracilis, right? And T, semitendinosus. So those three muscles attach right there, and it tells you the order. Sartorius is the superior one, then the gracilis, the semitendinosus, all attached right there. And there's a bursa between those three muscles and the tibia. For our purposes, in this class, it's just going to be MCL. But in real life, it could be a whole lot, many other different things. Then I'm going to palpate the lateral condyle of the tibia. Now I haven't included on your sheet that little bump right there. That little bump is Gerdy's tubercle. And that's where your IT band attaches, the iliotibial band. So when your leg is straight, the IT band is in front of the lateral condyle of the femur. When you flex your knee 20 to 30 degrees, the IT band goes behind the lateral condyle of the femur. So if you're a runner and you do that a couple thousand times on a workout, you think that can lead to a tendonitis? And there's a bursa between those two that can become inflamed. So that's not on your list because it's a little bit harder to find. But then we'll palpate the joint line. So again, you find the inferior pole of the patella, two dimples, and her dimples aren't real big, but they're there. So this is the medial joint line, right there. She has pain along the medial joint line. I'm thinking it could be the deep fibers of MCL, but it also could be the medial meniscus. I'm not really sure. So when I do the stress tests, again on the lab exam, only one thing will be wrong. Does that always happen in the real world? No, multiple things can be wrong. But if it's the medial collateral ligament, when I do the stress test for the medial collateral ligament, she's going to say, ouch, that hurts. When I do the meniscus test, she won't say ouch. If it's a meniscus injury, the stress test for MCL will be negative. The stress test for the medial meniscus, McMurray's test, will be positive. Okay? That's how the test is going to work. So, palpate the medial joint line, and then I'm going to palpate the lateral joint line. Then I'm going to palpate the tibial tuberosity, that bump right there, and shaft of the tibia, all the way down. Palpate the head of the fibula, and the shaft of the fibula, all the way down until it becomes superficial at the lateral malleolus. Everybody good? Okay, now, muscles. First three are three of the four quad muscles. Why didn't I include all four quad muscles? And I only put down three.
One deep.
Which one's deep? Let's say louder. Vastus intermedius. So, vastus means what? Vast. Large, right? Large medial muscle. Vastus lateralis is large lateral muscle. And rectus femoris means femur. Rectus means what?
Direct.
Right, direct or straight. So, lift your leg up a little bit and move your hands out of the way so we can see your thighs. I'm going to push your leg down, don't let me. That's vastus medialis, right there. Okay? Major bulk distal thigh. So I'm going to palpate that, and if it's a strain of vastus medialis, she's going to say ouch. Then when I do the range of motion and strength tests for that muscle, is she going to have a problem? Yeah, she is. Okay? So rectus femoris, I'm going to push down, don't let me. Rectus femoris is right there, and all of this is vastus lateralis. Okay, all three. And tibialis anterior. So last week we palpated the tendon at the ankle, but today we're going to palpate the muscle belly. So keep your knee like that, but just dorsiflex flex your foot. So she's got a good one. That's tibialis anterior. So on the knee you palpate the muscle belly. If you get the ankle card, you're going to palpate the tendon at the top of the foot on this medial side. So now you got to flip over in your stomach, please. So now we're going to palpate the hamstrings. So all three hamstrings have their common origin on the ischial tuberosity, that bump, bony prominence, in the center of your butt, right? Dead center. Biceps femoris goes lateral. Bi means what? Two. Femoris means femur. There's a long head and a short head. Semitendinosus, semimembranosus are on the medial side. But I'm palpating this leg, but she's not saying ouch. Why do you think that? The injury that she had was biceps femoris, strain. but when I palpate biceps femoris, she's not saying ouch. And probably her head's going to turn like 180 and look at me and give me a look like saying you're doing something wrong. What am I doing wrong? Say it louder. Wrong leg? So flip over. I'm testing that leg, right? Flip over. It's now over there. Now, do you think more than one athletic trainer, physical therapist, physician has screwed up on that? Does anybody have surgery on their knee? What they do in pre-op?
They mark the knee.
Right? So they don't get the wrong one. Right? They mark it, probably sometimes they mark it in a couple places.
Where they were cutting them, and the doctor, the physician wrote their names.
And how many times do people ask you, which leg are we operating on?
Probably a lot.
Right? So do you think people have made a mistake? Doing the wrong leg? So, but I won't switch over because I'm on this side right now. So the lateral muscle biceps femoris. So if you bend your leg up just a little bit, the tendon is pretty prominent right there in the lateral side. Comes down to the head of the fibula. But I want you to palpate up the lateral side of her leg. Then on the medial side, you have semitendinosus, semimembranosus. Semitendinosus, for this class, you don't have to differentiate the two muscles, but the tendinosus is right there. Can you feel that tendon? I still feel it right there. I feel it's a little bit thicker now, but semi means half. So you know where it attaches, medial condyle of the tibia. It's part of the sacral before T. From here to here is about the same distance from here up to her butt. Right? Then we have, relax for a second, the two heads of the gastroc. You can just say gastrocnemius, but there's a medial head and a lateral head. Those make up the popliteal fossa. Popliteal fossa is shaped like a diamond. Right? Diamond. Superior medial, semitendinosus, semimembranosus, superior lateral, biceps femoris, inferior medial, medial head of the gastroc, inferior lateral, the lateral head of the gastroc. So people, you need to know all that. Okay? What's important, besides knowing the boundaries, is what's inside of it. Right? You can move it back a minute. All the major arteries, veins, nerves that go to the lower leg, do they cross the front of the knee? The medial side? The lateral side? No. They're all in the popliteal fossa. So if you injure the popliteal fossa, you can compromise all those important structures, which you'll learn later in the semester. Okay? So ligaments. Now, MCL is a broad, flat ligament, superficial and deep fibers. Medial condyle of the femur to the medial condyle of the tibia, deep fibers attached to the medial meniscus. Lateral collateral runs from the lateral condyle of the femur to the head of the fibula. It's a cord-like ligament. Patellar ligament runs from the tibial tuberosity to the patellar ligament, and you got to flip over just one more time, and then you're done. The popliteal, we could get rid of all the soft tissue, and we finally get down to the capsule. You're going to see the oblique popliteal ligament. Whenever you hear the word popliteal, that means the back of the knee. Okay? Popliteus is the muscle that makes up the bottom half of the floor of the popliteal fossa. But the fibers run obliquely actually they run like this, from the inferior medial aspect of the tibia to the superior lateral aspect of the femur. So they kind of run like that, obliquely. Or MCL, LCL run vertically. Patellar ligament runs laterally. Okay, why don't you divide up in partners and do this for like 10 minutes, and then we're going to do ankle taping.